Hi, I'm Spencer Snyder, an Insights Director here at KLAS Research. Today, we're here to talk about the Digital Front Door Solutions, a vendor guide, a preview for an upcoming report here at KLAS. I'm joined by my colleague, Adam Charrington.
Hi, Spencer. Adam Charrington. I oversee our digital health team here at KLAS.
And we're also today joined by Carl, who's here from the Health Management Academy.
Hi there, my name's Carl Whitemarsh. I'm a director with the Strategy Catalyst team at the Health Management Academy. As the name suggests, my team serves senior strategy leaders at leading health systems. Thanks so much for having me.
Great. So today we're going to be walking through this upcoming report and some of the interesting findings, not only from this report, but also some of the things that we're hearing across the digital front door space, as well as recent research that we've been conducting here at KLAS. I'm excited to spend this time with you. What we've been able to do is try to understand in this buzzword of digital front door, what are we seeing when it comes to vendors who are front of mind for different healthcare executives? But before we go there, we're going to kind of take a step back around kind of the definition of the digital front door. Because as I mentioned, it's a buzzword, but what does it mean? So recently, KLAS actually produced a report around the digital front door to try and put a definition to that. So on this next slide, we're going to learn a bit about what is the definition around what is the digital front door. And Adam, do you want to talk a little bit about this research and how we kind of came up with the different pillars and the capabilities?
Yeah, absolutely. So like many organizations, we were hearing this term and we said, we really need to ask providers, what does it mean to them? And the answer was the definitions were all over the place. And so hopefully we were able to learn and share with the market at least what it could mean for some organizations. Early on, I said, if you interview 10 health systems about digital front door, you'll get 20 definitions. And so we hope that this offers some structure, and with this report we've done with the Academy, it offers even more clarity. So the digital front door is coming about because of the need to address consumerism in healthcare. You think of all the challenges our provider friends are going through. They have employee shortages, costs are through the roof, and breaking even is a major concern across almost every health system. So they need ways to simplify access to care. And so what we learned in this digital front door report, just as the slide says, a lot of the focus is on patient acquisition and some of those technical needs to find patients and bring them into care. What we also learned was there's a lot of these capabilities that are more provider-centric to help with their needs and their objectives. And sometimes the patient gets left behind a little bit. And so our message through the report and some of our other research we're going to talk about today is make sure you include that patient. Make sure you think of their needs about finding a provider and scheduling appointments and such. But it's really an important piece of healthcare technology that continues to come up today.
Yeah. And something I think is interesting as well is that our research, you'll see on the slide, it really does span the continuum of care. It starts pre-acquisition through the finding care, the during care, the post-care, and then it wraps back to the beginning. So I think that is something that's why digital front door is so front of mind for so many executives, is because it truly does span the continuum of care. And Carl, what are your thoughts on this on slide 2 here?
Yeah, well, first I'll say I love this graphic from KLAS. It's such an excellent one. And I know it's one that some of our members will recognize as well. And I think, a key insight here that I know some of my members have heard me say is, there's something approaching consensus on the core of digital front door, as the graphic suggests, in this case, finding and arranging care. But what's really also clear from this graphic and, came up in comments that you made, Adam, is there's really far less consensus among the other categories. So pointing to a real opportunity for leaders at their organizations to, hold hands on what a common definition or understanding of the concept looks like at their organization. And Adam, to your point around, sometimes in this world of the digital front door, the patient can be left behind with certain capabilities that we might, think fall under the umbrella of the digital front door. So that, I think, calls into question, the concept, the terminology, digital front door. Is that serving our needs? And of course, we're going to use that term today throughout the balance of the conversation, but I do think it's an important question to pose.
I appreciate that. And what we also saw in this report are some of the outcomes that are being achieved through the use of this digital front door. And as Adam mentioned, The top responses were more provider-centric outcomes around, having the ability to be more efficient with your time. But also about 20% of the respondents talked about how an increased level of patient satisfaction, which is obviously a huge goal for all these different health systems that we had a chance to speak with. So many important outcomes that are being achieved. And I think as we also saw, the majority of the organizations that we spoke to for that report felt like they were kind of emerging in their maturity. So this is definitely something that is still continuing to grow and is still front of mind, which we will hit on a little bit later with some of the research that we've been conducting most recently as we talk to more of these providers. Any thoughts on this slide, Carl?
Yeah, in taking a step back, I think one takeaway that stands out to me here is, for organizations in really close partnership with their vendors, I think there's an opportunity to bring more rigor to the outcomes that they will track and expect as part of any digital front door initiative and any vendor relationship, and to really bring balance between provider-centric and patient-centric metrics. You should have both for any capability that you implement. And, can you get to a level of granularity for an outcome like patient satisfaction, for example, that goes beyond kind of global PAT-SAT data that an organization would track? Meaning, can we bring a level of rigor to our outcomes tracking that would allow me to say, this is how satisfied our consumers are with this specific capability?
That's great feedback. And I think that helps also take us into have a better understanding of, for this report specifically, how did we get some of the data? So maybe Carl, I'll actually turn it back to you. Can you kind of give us an overview on how we got the data for this report as we gathered from the different respondents?
Absolutely. So, just as a reminder, our partnership with KLAS is really grounded in information sharing. And so circa July 2022, the Academy's Strategy Catalyst team, the team that I work for, conducted a double-blind quantitative survey of leading health system executives regarding the digital front door and, the status and maturity of about 14 specific capabilities at their organizations that we surveyed. So some of the data that you're going to see here today is informed by this survey, and we used the data coming out of this survey to really, we shared that with KLAS to help inform, what were the specific vendors that we were going to focus in on, that we were really going to target as part of the coverage for this report. The final quantitative survey represented unique responses from 30 leading health systems.
Yeah, and that is so helpful for us to understand not only where this data came from, but also what is really front of mind for those leading health systems when it comes to the digital front door. Now, as Carl mentioned, there were 14 different capabilities. And what we saw from the feedback from these leading health systems was that actually over 100 different vendors were identified across the 14 capabilities. So here on the slide, you'll see what are those 14 capabilities that these respondents were specifically asked about. And so you can understand not only, and you can see how you go through this list and we have an understanding on these capabilities and where they fall within those different pillars that we talked about early on. You can see here at these first few fall within that finding and arranging care, as well as that during care and that post-care process, or that pillar that we look at. You can see here, and something that you'll see called out in the report, none of the capabilities directly impact that pre-visit. So we kind of call that out in the report, and we'll kind of talk through that a little bit later in this webinar. But it is an opportunity, and was really exciting to see so many vendors be highlighted across these different areas. Now, there were even times where vendors were highlighted, maybe not in areas where they focus right now, but we saw where the energy is for some of these vendors, and we're going to highlight those who are mentioned most often and talk a little bit about them more.
That's really an indication of what the market is experiencing right now. Hopefully the model can give rise to coming together on a definition, like we've been saying. And even if there are many organizations they consider, at least it can help unify their own strategy and come together on that. So, but it's interesting on a macro level, definitions are a little cloudy. Lots of options out there. It's kind of some of the themes we see in this report as well.
Yeah, and for any health system folks that are tuning in, as you're thinking about reviewing this report and getting excited about it, you might be asking, okay, well, how can I tell which vendors are covered? The vendors that I work with, are they going to be included? We've got an appendix in the materials where you can see an exhaustive list of the 100 plus vendors covered. So we won't get into those slides today, but that's included in the materials for your review.
Great, thank you. And one of the things that is so exciting about the partnership between this research and this data that the Academy was able to capture in KLAS is the ability for us to understand of those 100 plus vendors for providers who go to this report and want to learn more, that we have the ability to highlight some of those vendors who we do consider what we call fully rated. So this is an opportunity for us to just have a brief overview of KLAS research and the impact that we're having in the market. You can see here some of the numbers around the number of executives that we partner with to gather feedback, as well as the number of healthcare organizations, the number of annual surveys and interviews that we're conducting. Something that I'm really proud of is that 90% of those 26,000 plus interviews are actually on kind of a one-on-one basis. It's an interview that takes 20 to 30 minutes. We try and go really in depth to understand what is going on for these customers and the vendor capabilities that they're utilizing. Now, what we see is that for those who we consider to be fully rated in any market segment, that means that we've had a chance to speak to a minimum number of customers and validate the work that they're doing. And that allows them to actually be eligible for our best in class designation, which is the highest rated vendor solution in that market segment. So in the report and in our webinar today, we're going to highlight a few of those best in class winners. And it's an opportunity where you maybe have seen this best in class designation if you've ever been to HIMSS or some of these other conferences. It really is something that these vendors are proud of, that they've been able to be the top rated vendor in their market segment.
It's really a key part of our roles that we get this information straight from the providers. And I consider it one of the most rewarding things I get to do in my job. We still collect research. Even the founder of our company still collects research. So it's a big part of what we do.
Yeah, and I was hoping that I could actually pose two quick questions to you. And Adam, maybe you can take the first one. This is something that really struck me as I was getting more acquainted with KLAS Research's methodology. Adam, I was wondering if you could speak to KLAS's philosophy around prioritizing participation of vendors and evaluations, even if it means foregoing a potential commercial opportunity. Could you speak to that?
Yeah, thanks for that question, Carl. So literally our number one commandment at KLAS is everything we do has to benefit the provider. And if there's data out there that we need to get for their benefit, we will chase that. We want to make sure that our provider friends have what they need. And yes, we are for profit, but we are mission-based first. And it's extremely important to us that we're chasing those areas of most interest. No provider wakes up and says, I need to buy new technology today. They wake up and they're chasing outcomes. And healthcare is just too important for us to not share this data with those that need it. So it's deep in our DNA to go find the hard to get data that providers need.
Thank you. And, my last and second question here is, for some of my health system members that might be thinking, especially when they see that 26,000 plus figure, is there an opportunity for me to share feedback on my vendors, and if so, how can they go about that?
Yeah, I'm happy to take that. So we are always interested to talk with provider friends, and hopefully there's some synergy that naturally happens. We're interested in sharing our data with them. So they can go to KLASresearch.com, that's KLAS research.com, and they can easily request to give feedback. And our hope is that we serve them every time and we can easily learn what they want to share. So appreciate that, Carl.
Yeah, one of the great things as well is with that relationship, as Adam was mentioning, allowing those providers to also have complementary access to our data, because we want to be able to have that give back as a thank you, that as you're making technology decisions, you can go to our website, you can look at these different market segments and understand what are my provider professional colleagues saying about X, Y, or Z? What is a report that's been written in this market segment that I need to be aware of as I'm making these buying decisions or purchasing decisions? So we do truly want it to be a kind of a give and take and a back and forth with those providers, but we welcome all providers' feedback. So please look us up on the website. Okay, well, we're going to move forward and we're going to talk a little bit about, before we dive deeper into some of these pillars, we actually want to highlight some research that KLAS has recently participated in. This is some feedback, and the links will be included in the slides that we send out. But this was feedback from a partnership with the Center for Connected Medicine. And what we were able to see is that as we gathered feedback from 60 plus health systems from leaders on what is top of mind for you this upcoming year, what we saw is that access, as Adam mentioned earlier on, is top of mind. How are they going to help their patients to be able to receive the care in the way and in the time that they need? And the reason we want to just highlight that, and you'll see other key findings here listed on the slide, is that all of this just ties into this concept of digital front door. It's how do I be seen in a way that allows me to not only go about my day in a way that's productive, but also that I can be seen quickly and in the format that I want. There's so much that is changing in the way that we're seen, in the way that we're cared for, and digital front door really tries to get at the heart of that, and is something that it's going to be exciting to learn a little bit more about some of the vendors that fall in that space.
Yeah, absolutely. Consumerism is growing, as we've said. It's not shrinking. As consumers, we have so many strong options to engage with organizations in a simplified way. I love to use Delta Airlines as an example, Chick-fil-A, Amazon. Insert your favorite example here. But the point is, we know it can be better. We expect it to be better. The pandemic brought up opportunities for us to engage in an easier way because we had to. And so access really continues to be top of mind. We hear it all the time.
Yeah. Hey, Carl, any thoughts on this one?
Yeah, and I definitely think it makes sense that access is such a top of mind priority is for health systems, especially when we think about, the increasing presence of these primary care disruptors that are prioritizing access over all else, right? We can all go onto one of their websites today, get an appointment, same day in some cases, but definitely tomorrow. And though we might not be able to tailor that experience so much to our personal preferences today, they probably have an eye to that, right? Right now, I think today, that's an advantage that leading health systems have over those disruptors, but they are certainly beating out many leading health systems when it comes to access.
Right. Well, now we're going to dive a little bit deeper into some of the data and the results of this report. So as I mentioned, there were 100 plus vendors that were mentioned by the different respondents for this. What we saw is that actually 21 of those vendors were mentioned for at least 2 or more capabilities. So those are the ones that had a lot of energy, a lot of feedback from the respondents that we spoke to. You can see here there were also 8 vendors that were mentioned 3 or more times. You can see listed on this slide, and in parentheses was the number of capabilities that each of these vendors was mentioned for. Now we're in the webinar, we're going to give you a few snippets of what you're going to see in the report. So different ways that we've tried to visualize this information. So this might be a little bit small, but this is an opportunity for you to see, okay, quickly in an easy to digest area to understand who is front of mind when it comes to digital front door. What are the capabilities that you see, and which pillar are they kind of falling across? So these are some of the ways that we've tried to make this report digestible, easy for somebody to pick up and understand who's front of mind in these different areas as well. Adam or Carl, anything to add to this one?
Yeah, and as folks are taking this in, can you confirm, what the circles denote on the right? That shows a particular capability, listed at the top that each vendor does or does not support, correct?
Yeah, so what this actually denotes, there's only one small change from kind of what you said, is that for the data that's presented in this slide, it was just where a vendor was mentioned. So whether or not they have this direct capability or performing this capability, we did not designate that in this section. We wanted to just highlight from a high level every vendor who was mentioned for a capability. Now, as you can see, Salesforce, they're actually mentioned for 6 capabilities. Now, all of these capabilities are not ones that they are deeply playing in right now, but we felt it was important to at least highlight where these respondents said, hey, I think of Salesforce when I think of this capability. And so it allows people to understand where the thought process, what is the energy behind these different vendors for these different capabilities. Now, in the report, when we get into each of these pillars, we identify where KLAS actually maybe measures them and where we've been able to gather performance data for a specific product. So you'll see more detail or granular information in the report for each of these capabilities where we do have them as a fully rated vendor. Okay, we'll move on. So another thing that we also wanted to highlight was as we are identifying new and emerging technology, there's actually a process that we go through here at KLAS where we are producing different reports that we call spotlight reports. So one of the vendors that you will see here noted, Notable, who was mentioned, across 4 different capabilities. So one of the highest noted among the respondents for this report, we actually produced a spotlight report for this vendor last year. And we wanted to just give people a quick overview of what these spotlight reports. This is an opportunity for us to understand, okay, is this a new player in a space? Is this some technology that's new or emerging? Anything else you want to add to a spotlight report, Adam, when people are looking at these or seeing them come across?
Yeah, this is in direct response to providers' requests for KLAS to go faster, to validate what's new and emerging, disruptive, like you say. And we hope it serves them directly. There's many solutions out there. And I imagine a lot of organizations have their heads spinning of where do I even start? So this is a validated quick read report to show, hey, here's what the vendor claims they do and what KLAS was able to validate.
Yeah.
And speed to outcomes and things like that. So a lot of these vendors in the report also have spotlight or targeted reports that we've already published, and we hope that's helpful.
Yes, and what you'll see, this next slide just kind of shows you a brief overview, because these are usually 2 to 3 pages, very easily digestible, and you can see it includes information on kind of the bottom line. Hey, what do they do? What are some of the performance indicators that we've been able to go out and validate, as well as giving the vendor an opportunity to just self-report some things. What are things that make them a differentiator? What is driving levels of success for them? So you can see that listed here. And as Adam mentioned, it's important to understand in the report, for any vendor that has a spotlight report, we've created hyperlinks throughout the entire report for you to directly just click on it and have you drive to the KLAS website so that you can once again have that quick read and quickly understand what's going on in this space.
So great. And Adam, to your point about these reports being in direct response to provider requests, I think this is a real opportunity for any health system folks who are tuning in to kind of put your thumb on the scale and help steer KLAS Research's direction. So if you have vendors in mind where you might notice that today there might not be KLAS Research coverage on your website, please let us know at the Health Management Academy, because we want to pass those leads on to KLAS and help build out that coverage.
That's great feedback. Now, another thing that we want to do with some time during our webinar is to give kind of a sneak peek into what is some of the information that you may get out from a certain vendor who is fully rated. So we're going to go back to that list of those 8 that were mentioned 3+ times. And you can see here highlighted, there's 3, Salesforce, Phreesia, and Epic are ones that we're going to kind of walk you through what is some of the information that you may see in the report for their specific product to give you an idea and hopefully have you excited to be able to drive into the report when that comes out as well. So the first one we're going to talk about is falling within that kind of pre-visit digital marketing acquisition. So for this one, you can see it's a number of things. It's social media, email campaigns, SEO, also the CRM. And that's the one we're going to dive in a little bit deeper when it comes to Salesforce. So one of the things that you'll see in the report is kind of what we call kind of a bottom line, which is as we've had the ability to talk to that minimum number of customers and really validate what's going on for that customer, we try and create an easily digestible 2 to 3 sentences to help you understand, hey, what are the things that are going well for this vendor, maybe where there's some pain points or opportunities for them to improve, and to give you that. So you can see that those are listed here on the slide for Salesforce, but it's an opportunity for, once again, providers to understand what's going on with any particular vendor. Now, in the report, we're going to give you just kind of a brief snippet here of how we've tried to kind of, once again, visualize this. So you can be able to see, okay, here's the vendor name. You can double click on that to be able to go straight to the website to learn more about that vendor. You can see things like their performance score out of 100, and then that bottom line listed as well. So we hope that this will be an opportunity for providers and those who access the report to quickly go in, see who has a lot of energy, understand what's going on, and then be able to dig deeper, double click on any of those links for areas that they're really interested in at this time. Anything else you would add when it comes to Salesforce, Adam or Carl?
This is a space that's evolving as organizations try to think of the lifetime relationship with a patient and not just bring them in the front door, but keep them from leaving out the back door. So tools like CRM make a lot of sense. There's other categories KLAS has created related to this. Patient-driven care management. It points the reader to thinking about the journeys that patients are on. And you look at organizations that have come in from outside of healthcare, There's groups that came out of Procter and Gamble and how they have deep consumer insights. That's very prevalent today. You see a lot of examples there. So Salesforce has grown up with these marketing strengths, and they have evolved to be able to help with guiding that patient through their journey. I know we're going to get to Epic in a moment, but they have their own CRM now, and we're learning more about that. So it's a space that I expect will continue to grow.
Okay, great. Carl, anything else to add on this slide?
Yeah, and I would echo your comments, Adam, and just add that we've got lots of data from our members at the Health Management Academy that they're super interested in the CRM strategy. They know they have a real opportunity to achieve higher levels of maturity there. And I think, Adam, to your point, not only is it going to be a tool to help them measure total value of a certain patient, or to be able to assign a dollar amount to this idea of loyalty or share of wallet, but I think it's also really what they see as the potential. It's going to be a capability that will allow them to increasingly help personalize the experience for patients, whether that's in the communication, but even perhaps the actual care that they're receiving as well.
And Adam, I loved how often you mentioned the word patient, because what we have seen, this is actually kind of a little bit of information from a recent report that KLAS published, which is around the patient perception. Because what we realized is that oftentimes the patient is not involved enough in where technology is headed and where they want to see things progress. And so maybe talk us through just very high level about this report and what we were able to kind of find.
Yeah, this goes back to a quote that I heard with my own ears from Adrienne Boise. She was the chief experience officer at Cleveland Clinic. She's still a practicing clinician. She said it's an oxymoron to call it patient engagement and not involve the patient. And boy, that hit me right between the eyes, that here we are measuring patient engagement deeply, had never talked to a patient before. And so the idea came that we need to make sure we're including their perspective. At times, there's a B2B relationship or a B2C in healthcare technology. Yes, the patient doesn't buy the EMR. They're not purchasing Salesforce, but they are the ones being impacted. And if we're not listening to them and involving them, we're missing an opportunity. With the help of Frisia, we went out and interviewed 13,000 patients about their perspectives, what they hope to see and have with digital health experience. And not only did we learn about their preferences, we were able to compare it with what vendors were telling us and what providers were planning to invest in. So triangulating those three stakeholders really opened our eyes to where healthcare needs to go next.
Yeah, and that's exactly what you see on this. I love this slide, because what you see here in these orange bubbles is kind of the desirability, or what patients are saying, this is what I want. And then you can see in the gray and blue bubbles, it's where the provider and where the vendors are at in regards to those different capabilities. And the one that always really sticks out to me is this one around the appointment scheduling. This huge gap where patients are saying, I want this, I want control of it. And then vendors and providers not kind of meeting that expectation. And that obviously that level of appointment scheduling plays deeply within the world of the digital front door. And that falls into that finding and arranging care one, which we're going to talk about next. But Carl, I wanted to give you a chance if there's anything you want to add here before we move on to that.
Yeah, and I would just add, Spencer, you took the words out of my mouth. I also love this graphic. I think it's one of the most powerful ones that I've seen coming from you all at KLAS. And I think we're right to really call out that sizable delta, but for schedule, reschedule, and appointment. I think that's well in line with the recent body of work that my team has done around evaluating the self-scheduling experience at 42 leading health systems at this point. And I think even in speaking informally to some contacts that I have at different vendors, I think there's a real fear among some provider organizations of ceding some of that control over their schedule. But we know with a lot of certainty that it's something that consumers are very hungry for, are demanding and expecting, and already have a lot of experience with in other industries.
Yeah, that's great feedback. Now, as we were mentioning, this process of that scheduling does fall within that pillar of that finding and arranging care, which you see here on this slide, the different capabilities that were asked for this report. Now, one of the other ones that really is front of mind for a lot of the providers is also around this kind of process of that digital patient intake. This is one that's drawing a lot of energy, a lot of excitement. A lot of vendors were mentioned for that capability. Now, one of the vendors that we're going to highlight here who's fully rated by KLAS is Phreesia. You can see here listed some of their performance data, as well as kind of how we are planning to kind of visualize them in the report. But this is one where, once again, when you talk about a vendor like Phreesia, a lot of energy and excitement, especially in this space around COVID. COVID, I think, really sped up some of these capabilities, but customers had talked about when it came to Phreesia, how much they appreciated their ability to move fast and move quickly. When you talk about things like allowing people to check in from their car, or these things that we had to move on quickly, that is something that customers are still talking about in 2023 in regards to Phreesia. And I think it's one of the areas that is driving a lot of satisfaction for them. Now, something we do see with them is as they have scaled and grown, has their level of support dropped a little bit. That's been a concern or kind of a pain point for some customers, and something that they're working on as well.
Yeah, and the capability itself, I want to touch on that for a moment. It really is addressing multiple needs. Patients want simplicity. The providers need more muscle to help getting patients in and taken care of. This is a natural fit. And so we're, as Carl mentioned, as consumers, we're already doing this. We do this in travel and in banking and in the food industry. Yeah. So there's so much synergy here already. And again, an area that's important to patients that seems to be doing well.
All right. Thank you, Adam. Carl?
Yeah, and I think, Adam, something implicit in your comments is, for any capability that a health system is thinking about implementing, they really need to have a clear idea in mind of what are the jobs to be done, not only for the patient, of course, but also necessarily for the leading health system staff as well, right? For the end user at the health system who's going to be interfacing with that capability. And I think digital patient intake is a clear example of, a capability that's going to be serving kind of those dual jobs to be done, both for the patients and the health system.
Now, before we get into kind of the last vendor that we're going to highlight, we also want to show just some actually unpublished early data for a really exciting report that's going to be coming out. This is an opportunity where we have had the chance to talk about what is top of mind for 60 plus executives this year regarding patient engagement technology. And the reason I really love this report is because we were asking them not only what problems are you trying to solve using patient engagement technology, but where are you going to be investing your dollars in the next 1 to 2 years? So I think that that's been a really exciting thing. Any background on this report before we show some of those initial findings?
It's just further evidence that this is the topic of the day. Organizations are telling us, even in this economic environment, they're still planning to focus here. And with many conversations already collected, several more to come, we know that access, meaning getting the patient what they need, when they need it, where they need it, is still top of mind. So I think it complements really nicely what we're about to publish with the Academy.
Yeah. And here are a few of those early findings on, once again, what problems are they trying to solve with their different investment dollars over the next 1 to 2 years. And you can see here around patient scheduling, which we've already talked about, and the digital front door, which those two things are one and the same. And those were by far and away the #1 response from these executives on where they plan to utilize their dollars and investing in order to solve some of these problems that are taking place on their day-to-day.
If I can add one other thing, one question we're asking in this report is, what do you plan to unplug or stop using? Mm-hmm. And most organizations are saying nothing. There's talks of consolidation, but they know this is where they have to be. The train has left the station, and it's just how can they pick up speed here more than change direction?
And I think when we think about kind of moving up the digital hierarchy, right, and we're going from disparate capabilities to capabilities that we're managing as products, right? We might get to a point one day where those products that we're managing are no longer meeting the jobs to be done for the health system or the patient. So it would be appropriate, right, to sunset that. But I think that the majority of health systems are really not at that stage of maturity in most cases. And that's why it is just a game of more and more adding on more. because that's really where health systems are finding themselves in a place where they do need to build out their digital capabilities versus getting to a place where, they're managing these capabilities as products and they've gotten to a point where they can sunset it for something better. I think we'll probably see more of that, and also seeing, that trend of consolidation, Adam, that you mentioned. But, and lastly, I would just say, Spencer, you kind of hit on this too, but again, right there at the top, I think, again, we're seeing evidence of that theme of outsized focus from health systems on this topic of self-scheduling.
Okay, now we're going to talk about kind of the last pillar that we had mentioned earlier, which is around kind of the post-care digital engagement. Now, this includes a number of the capabilities that you see here listed on the slide, one of which that has a lot of energy, which you saw from the responses on the last slide around the patient portal. So the patient portal is an area that has a lot of energy, a lot of vendors that were mentioned in this space, one of which is Epic MyChart, which is one of the fully rated vendors here by KLAS. They were actually the 2023 best in class winner for patient portals. So a lot of satisfaction is being driven for this from their ease of use, for the ability to be integrated and run very smoothly. Now, there is some pain points around some training and feeling like, hey, I want to get the most out of my money with this product, and I would like to receive some of that additional training as well. And you can see here how it is going to be highlighted in the report as well. But overall, this is a space that, once again, is not going anywhere. It's where a lot of the satisfiers are taking place for consumers within that patient portal, and trying to improve that ability to have that communication take place, not only around an episode of care, but also throughout the years you go to access those different materials.
It really is the vehicle to drive a lot of engagement, especially in this case with Epic sites. That being said, there's still a hunger from providers to be able to go deeper and wider and simplify access. Yes, the content may be there. Yes, the process may be improving. How many patients are logging into their portal? And there's a whole discussion we could have on that of you've got your chronic patients versus episodic. We've got data on the differences of ages and so forth. But you're right, it's not going away. It is there. It's an essential part of a strategy.
Now, Adam, with an earlier comment that you made about Epic, with Epic, rolling out their own CRM platform, that almost, preempts a question that I have, and it's a question that I've gotten from our own members, and it's this, to what extent have you heard that really Epic is, paying attention to the capabilities that these other vendors are offering in the digital front door space? And, what are their plans to build out similar capabilities to compete? I think everybody thinks of Epic as the EMR records. We might not think of that firm as being as consumer facing. I really think that's changing, right? And I'm just curious what you've heard on that front as well.
Yeah, so organizations that use Epic that we have spoken with will talk about expanding the use of MyChart and the potential there. So some examples. There's Care Companion, tools to really communicate better with patients and guide them. That complements nicely with Cheers, which is the name of their CRM. And so they're really just expanding what MyChart can do. Again, that being said, providers still want deeper access. They want simplified access. They want the ability to share information with other caregivers or family members. So Epic's capabilities are growing. They're known for their high service, but functionality wise, it's catching up with other tools in the market.
Great. Well, I hope that everyone has had the opportunity to learn not only something new about the digital front door process, but also be excited about this upcoming report, and that everybody will have the opportunity to double click on some of these areas, some of the vendors or spaces that they're playing in deeply. But I wanted to also give Carl and Adam a chance. Any final thoughts before we move to the question and answer period?
I'm just grateful for this partnership, and Carl, you and the team have been so supportive, and boy, we just enjoy that synergy tremendously. I would just say, related to the topic, that digital front door is expanding, and our advice is that as organizations can agree on definitions, as they can really focus on key issues to solve, they're going to see some progress. the number of solutions on the market is going to keep expanding. It's not going to be shrinking, and it's really going to take a thoughtful plan in place rather than just chasing the next shiny object. Don't get me started on AI. If you just call something AI, it's the magical fix for everything. More to come on that, Carl. Maybe we talk about ways to explore that together in the future. But you know, that's an example of how healthcare continues to evolve, and you've really just got to start with that core strategy and focus on it. So that's what I would add. Carl, what would you share?
And Adam, you're bringing us full circle. You know, how's that for a buzzword? AI, right? We started off this presentation talking about the buzzword digital front door. How's that one? How's that for one as well? And, you know, lastly, I would just echo, you know, your sentiments, Adam. It's been really rewarding to partner with, you know, such esteemed partners that I have in you all at KLAS Research. So thanks for the opportunity to be here today.
Thank you.
Okay, we're now going to move into that question and answer period.